and we also know there is a huge amount of the potassium is present to the cell. What is the normal level of the potassium which is present to the cell? What is the normal level of the potassium which is present into the cell? Anyone? It is a basic physiology, cell physiology. When you study the cell physiology, there's also mentioned about the normal level of the potassium. The normal level of the potassium which is present into the cell, it is a 150 to 155. How much? 150 to 155. And the level of potassium which is present through the blood, it is round to about the 10. It is round about 5 to 10. And we know that when there is enough insulin production is going to happen, when the insulin will be present in the cell, when the insulin will be present into potassium will be present into the cell, when potassium is present to the cell, the level of the potassium will increase in your blood. So it can lead to the hypokalemia. On the other side, what I said, on the other side, I said when there will be no insulin production, the potassium will not go into the cell. When the potassium will go into the blood, when the potassium will go into the blood, it means that when potassium is going into the blood, the level of potassium is increasing into the blood. When the level of potassium is increasing in the blood, it can lead to the hyperkalemia. It can lead to the hyperkalemia. But when it can lead to the hyperkalemia, this potassium also going toward the kidney and it will go into the urine and excrete from your body. So the total level of potassium will be depleted. Whenever you will do, for example, after 4 to 5 months, inshallah you guys will do house job in your country, and we see in medical emergency many patients of diabetic ketoacidosis. We will discuss about the complications of diabetes. But what we do into diabetic ketoacidosis? In diabetic ketoacidosis, as we know that there is a high level of the potassium is present into our blood. We also give the potassium. We give the potassium. What is the reason behind this? Why we give the potassium even the patient has the hyperkalemic condition? Anyone? Why we are giving the potassium? Because it is excreting from the urine. The total potassium level is depleted. When the total potassium level is depleted, that's why we are giving the potassium into our body. And it is very important. And for the excretion of the insulin, it must to have the potassium. When there will be no potassium, insulin is not going to excrete. If you have a low level of potassium, insulin will not going to excrete. Clear? Now we'll discuss that how many types of diabetes mellitus, type 1 and type 2. Where the insulin is going to produce from which cell? Beta. Where the insulin is going to produce from which cell? Beta cell. T cells basically attack on the beta cells. When T cell will attack on the beta cell, it means that your immune system is attacking on your own body cells. And a condition in which your immune system is attacking on your own cells, this condition is known as. And in type 1 diabetes mellitus, T cells are attacking on your beta cells or your body cells which are normally pancreas and present in your pancreas, and the main function of the beta cells to produce the insulin. When T cell will attack on the beta cell, then insulin production will be occur? No, then insulin production will not going to happen. So it means that in type 1 diabetes mellitus, it is an autoimmune disease. It is an autoimmune disease. You guys will say that it is an autoimmune disease. When it is an autoimmune disease, we see here is a type 4 hypersensitivity reaction. We see type 4 hypersensitivity reaction. Which type of the antibodies also will be present into the type 1 hypersensitivity, the type 1 diabetes mellitus? Which type of the antibodies can be seen in a patient of type 1 diabetes mellitus? And very good, Shabash. Anti-glutamic decarboxylase antibodies. Which type of the hypersensitivity reaction is into the type 1 diabetes?